There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is the cause of my hypertension? Answer by Owen Kimberly. The three main causes of hypertension are, let's go over each in detail. The changes in the content of blood can affect its fluidity, or in other words, its thickness. When the blood becomes too thick, it gets hard for it to circulate through the vessels efficiently. This causes the heart to squeeze harder to send the blood to the extremities. When the heart pushes harder, blood pressure automatically increases. The content of blood changes due to fluctuation of cell concentrations or taking several medicines. 2. An increase in the amount of blood. Show that there are too many molecules of blood in the vessel. Sodium from salt increases blood volume. When there is more blood to pump, your heart will have to work much harder. Therefore, pumping blood with more force will increase the blood pressure. When you eat salty foods, sodium enters the blood vessels. To equalize the sodium concentration, the vessels draw water from the tissues, leading to an increased volume of blood. A4 show increasing size of blood vessel due to increase in blood. 3. Narrow blood vessels show that the blood vessels have narrowed. When your body is under stress, it responds by releasing certain stress hormones. Amongst the many functions of these hormones, one of their functions is to signal blood vessels to constrict themselves, that is, narrow down in diameter. When the blood vessels lose their diameter, it makes the area for the blood to flow through very small, which again causes an increase in blood pressure. A5 shows size of blood vessels decreasing. Other reasons that cause a high blood pressure include alcohol abuse, sedentary lifestyle or inactivity, smoking, obesity, and underlying medical conditions such as congenital heart diseases or kidney disorders. Answer by Roy Gillen. Generally speaking, hypertension is classified as either primary or secondary. Primary hypertension is defined as high blood pressure in which secondary causes are not present. Most people with high blood pressure have primary hypertension, as it accounts for about 90% of all cases. Secondary causes include kidney problems, medications, breathing problems, sleep apnea, tumors, oversecretion of hormones, etc. In some cases, your doctor will decide on screening for these causes. Remember that clinical diagnosis of hypertension should be made by a healthcare professional. You should visit your primary care physician and decide on clinical investigations and treatment plans. For better communication with your doctor, use our new application, My BP Blood Pressure Tracker. Click here to check it out. Medical disclaimer equals 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 equals. The comment contains general medical information. Do not use the information as medical advice. The information is not a substitute for medical advice. No warranties or representations are given in relation to the medical information. Please consult your physician if you have any questions about any medical matter. Answer by Conan Rasa. Essential hypertension or primary hypertension are the most common form of hypertension. Almost 95% of the hypertensive patients have essential hypertension. It is idiopathic, cause not identified. Though it is idiopathic, but there are some factors which increases the risk of having hypertension. Hope this will help.